We've always been concerned with trauma-informed care at the Charlotte Maxwell Clinic, but we're just going to talk about it a little bit today. We used to have a much more intensive training for our volunteers, and so we just want to talk about how this relates to our hands-on care in the room. So, and I want to start with this quote from Dr. Gabor Mate, because I think it really informs how I would like to invite you to think about our clients and trauma. So I'm just going to read it to you. You can read it to yourself too. Trauma is the Greek word for wound. Trauma is not what happens to you. Trauma is what happens inside you as a result of what happened to you. If the trauma was what happened to you, you can't make it unhappen. But if the trauma wound is inside you, that wound that you're carrying, there's potential that you could heal that at any time. And so I'd just like to ask you to kind of keep that in your mind going forward. I actually have a few notes. Let's see if I can use them. In unhealed trauma, this is from the Acupuncturists Without Border. In unhealed trauma, we can see some of these dynamics, and they come into the treatment room with our clients, right? People, for whatever reason, whatever their trauma is, they may have shame, and they may have, that may lead to dissociation, may even lead to confusion. And sometimes people say yes because they're trying to be a good patient. But really, they want to say no. And so there's, these are things that, this is why we don't call our clients patients. We're trying to do everything we can to make people feel seen. And this is a document that we're working on. It's under construction right now, and you'll all be helping us with this. This is some core principles that we came up with as a staff recently about trauma-informed care. So I'd like to go through them a little one by one and talk about them. And so let's start with safety. We want to make sure that our clients feel safe, physically safe in the room, emotionally, psychically safe in the room. Another concept that we wanted to think about and be really mindful of is trust and transparency. So I want you to think about when you're in the room with the client, how do you establish a sense of safety and a sense of trust and transparency? We also want to create peer support. One of the things that's so heartwarming to me right now is to see you all here together in different modalities. But we also want our clients to have peer support. Collaboration and mutuality means it's not something I'm doing to you. It's something that we are doing together to facilitate well-being. And all of you know, if you've been volunteers at the Charlotte Maxwell Clinic, that you really aren't only giving healing energy, you're also receiving healing energy in that. That's sort of an amazing part of mutuality. We want to make sure that our clients know that they have a voice, that they are empowered, and they have choice. I personally got some feedback from a volunteer, or from a client recently, about what a big difference the volunteers at the Charlotte Maxwell Clinic made in her healing journey. It completely transformed something that was a cancer nightmare to her having a sense of, I have choices and I have power. And that's a really important part of trauma-informed care. And again, this goes back to the roots of the Charlotte Maxwell Clinic, talking about cultural differences, historical and gender awareness of the status of where the client is. So I would like you to think about, when does the trauma-informed care begin? You know, if you're looking at all of these things, when does it begin? So I'm going to just go on a little bit. If we're talking about trust and transparency specifically, what might that clinical transparency look like if you're working with someone who's still having unhealed trauma in their body? And I believe this is an issue of ethics, because if a person is not able to give you true consent, then you have to make sure that they feel, going back to those beehive 6 principles, making sure that you're holding that space for them. So why is it an issue of ethics, trust and transparency? I don't know if I really want to go into a full conversation right now, but we'll talk about this more in our breakout groups. But I want you to think about ethical actions and choices that you might make in the treatment space or in the clinic or elsewhere in your world, but specifically with our clients. And how will they help survivors assess risk and find safety? So if you're making choices that make someone feel safe, making them feel empowered, making them feel connected with, you're going to be offering more of those choices and more autonomy to the clients. This is a very busy slide. But this slide talks about what the basic thing that I kind of want to mention about this slide is when you're feeling safe and comfortable, you're here in social engagement. I'm going to do this. Why not? In social engagement is when you're in the present, you're feeling grounded. This is basically a slide about the vagus nerve and the polyvagal theory, which is way too complicated to go into right now. But, when you start feeling stressed and you go into fight or flight, when you get to the maximum of fight or flight, you can even go into freeze. So basically, we want to try to keep our clients here, but often they come in up there. So this is just a point that I want to make to you about how important it is to take care of the nervous system of yourself coming in, so you're not flying in, on your broomstick. And also, we've all had that moment, right? Where like Blondie and Dagwood, you're coming in at 100 miles an hour, and take a moment, ground yourself, and really be with the person and be with what they're presenting, because you want to help them come into the green zone. And if you want to know more about this, I just want to tell you about a book that was written not by Stephen Porges, but by his son, Seth. It's called Our Polyvagal World. You can check it out at the library on audio. And he really goes into a wonderful and accessible explanation of how the vagus nerve has to do with our nervous system and our sense of well-being and our sense of ability to heal. Because if you're up there in freeze, guess what? Your nervous system, your immune system isn't working very well either. So my fancy pictures with lots of words is really to just kind of describe that vagus response and how it affects our ability to heal. So here are some symptoms that you might see when a person's nervous system is out of balance. How many people have seen people with insomnia in our clinic? Right. Okay, so all other digestive issues, like, irritable bowel, also memory lapses. It might not just be chemo brain. It might really just be autonomic nervous system stress. Migraines, anxiety, depression, terror, rage. People come in, and we see this all the time. The staff actually has a little smile about this. Oh, the client came in and they were raging, and then they got their treatment, and they came out and they were just floating. Same client. Nervous system reset. So we see metabolic disturbance, as Nishanga said earlier, endocrine disturbance, even cardiac symptoms, weight gain, blood sugar, all those things. So the point that I really want to make for you as working with trauma-informed care and the ethics of that is making sure that you're getting truly informed consent. So I want you to think about, what practices do you do that support survivors? How do they feel safe? How do they assess risk and finding safety? There's a couple of suggestions of quotes here. And these are things that I often use with clients, not just Charlotte Maxwell clients, but I want to treat these points to address the themes I'm hearing from you today. How does that sound? You've had a conversation, they've told you what they're working on that day, and then before you just dig in, just say, this is what I'm thinking. How does that sound to you? Oh, you don't want me to touch your back? Okay. well, let's rethink it. Let's work out something together. And another great question at the beginning is, how would you like to feel when you leave here today? Because sometimes that helps them notice the change too, and helps them notice that they've shifted into a different space. Oh, and there it is. Would you prefer a front or a back treatment? Yeah. So I know that's not true for every modality, but whatever your modality is, to really think about, how do you make it transparent and safe for the clients? So important. So these are common trauma triggers in healthcare settings. Authority figures, I hate them. Sensory cues of past events. So I have a certain color of green that I associate with the trauma in my life, and if I walk into a hospital room and I see that color, I'm out of there. I just don't even want to be there. So lack of power or control, and this is why it's really important to make sure that your clients feel empowered when they come into the room with you. Feeling threatened or attacked, of course, that's a trauma trigger. Caught by surprise. I've had this experience of walking into the clinic and seeing someone I'm really happy to see and going, hi, and they go, so even when you're happy to see someone, you got to be careful not to catch them by surprise. Feelings of vulnerability and rejection, sensory overload, shaming. These are all common triggers that we want to be aware of in case the person in front of you has some unhealed trauma that relates to these things. This is a slide for all of us, the caregivers. Secondary trauma and compassion fatigue. And, we heard earlier that laughter yoga is a great, has been studied with nurses going through COVID. I can't think of a more stressful job, that it was really helpful for them. So now you have a new tool in your tool belt if you've never done laughter yoga before. But there are other things that we can do too. So these are some of the things that let you kind of know you're getting into secondary trauma, maybe. Lowered concentration, apathy, can't get off the couch, rigid thinking, perfectionism, preoccupation with the trauma, or maybe withdrawal, or sleep problems, or appetite changes, hypervigilance. It can be emotional responses like guilt or anger, feeling checked out or numb, feeling helpless, or even physical changes like increase in your heart rate, pain in your body, more frequent colds, impaired immunity. So these are all things that I would like to invite us to have a conversation about now. Can I do that? Do I have time? Okay. About what have you done, or what have you learned for yourself about how do you take care of yourself when you start feeling some of these things? I think this is a really nice opportunity for some skill share and some uplifting of things that people have done. So I'm going to walk out here. I'm not going to jump off. I do want to, but I'm not going to. Okay, I'm going to. Yes.
I have to try to remember the things that help me feel good, because I have a tendency to forget those things when I'm busy and doing crazy things. But, going to the sauna, just relaxing and doing things that, for me.
Doing things for yourself.
Learning that I had PTSD because of some hidden trauma that I blamed myself for 33 years. I had to learn how to forgive myself. And doing that daily is very important because it's so easy to slip back into depression, guilt, or having some other anxiety.
So self-love, self-forgiveness. Excellent.
Not to be that person, but I get acupuncture.
Thank you. I paid her to say that. Does anybody else have any? Oh, Dolores, can I get over there? Oh. Yeah, if people want to come up here, there's a mic. You can just, is that one on? Great. Well, please step right up to the mic. Anybody else just come right up to?
So I was going to say journaling.
Journaling.
Yeah.
Excellent. Journaling. So when you're starting to feel compassion fatigue, or you're starting to feel stress, or you're starting to show some of these signs, what do you do? I'm hoping that a couple people will just be brave and come up and testify at the microphone over there. But
like pleasure and body practices, like there's something when that fatigue hits that it just like everything looks a little cloudier, things aren't as beautiful, it's crunchy inside. And so finding like the practice we did today, like soothing the nervous system with the body, like the body often feels like there are places in the body that can feel nice, and finding beauty, like letting the sun be really beautiful, like actively looking for it.
thank you. Anne, thank you.
Okay, so
We got Anne and Anne.
I invited this other Anne because it's such a great name. We met before, but I just want to tell you that I go for a walk in nature because that restores me. But also I go to water, any place I can find water, to watch it flowing or to jump in a pool or something like that. But I have to do something to move my body in order to make me feel better. And the second Anne, I pulled her up here. I said, say something, say anything.
I do one of the two things. First thing is the constructive rest. It sounds kind of some technical thing, but it is basically laying on hard surface with a soft cover of book underneath me with knees drawn up so your feet touches the floor. And then I self-observe what changes happening in my body. So it's in a form of self-observation and meditation at the same time. And surprisingly, that you may find that your body opens out and your whole nervous system calms down. Another thing that I do, which I really love, that Marilyn shares, is grounding myself either through standing meditation or practicing Tai Chi. So those are the two things.
You're wonderful.
Great, thank you. Anybody else? I was hoping someone would say meditation. Please, please.
I struggled a lot in acupuncture school with this secondary trauma. I had a lot of anxiety. That was really uncomfortable because when you're hearing people suffering over and over again in their stories, it really affects you as an empathetic person. And I definitely did a lot of the things that people are saying here to help me feel better in my body, but sometimes, at work to maintain that healthy boundary, I just actually talk to myself either in my head and I just say, it's okay. I see that this person is suffering and they're having a lot of hardships in their life due to circumstances, but I'm not right now and I'm really blessed and that's okay. I don't have to feel guilty for that, and I can actually be available for people and hold that space for them because I am really blessed right now. But I used to have a really hard time struggling with releasing that guilt because there is so much injustice and suffering in the world, and it can be really hard to be a witness to that all the time without thinking that you need to take that on and suffer with them. But you can share that space and share that love with them, but so just practicing they're going to be okay. I'm going to, help them. I'm going to be okay. This kind of words like that, self-soothing. Yeah.
Thank you. Yeah, the porous boundaries of healers can be a tricky one, right? Learning how to know where you stop and they start. Is there anything else that anybody wants to share about what you do when you're starting to feel some secondary trauma or compassion fatigue? Please come right up. You can go there.
time with animals, which over the course of my time as an oncology and a hospice nurse, there was a long period of time where one of my therapy and personal therapy animals was actually a chicken named Marigold, who was alive for 8 years. And I would come home after work and I would go straight to the chicken coop before I went inside, and I would hang out with this bird that purred like a cat.
Oh. That's wonderful. Our animal companions can be such healers.
These are also great. I realized while I was standing over there that one of the things that I remind myself to do is dance. Just a little bit of movement goes a long way. And also hearing music that I like to dance to is, kind of evocative. And the reason I came up here is to say that I've had a couple of diagnoses that I could say were slaying, but not like what we see in many of our clients. Anyway, that said, I've begun to think about what's the gift inside of the challenge that's presented to me. And when I look at it from that point of view, like, oh, my breath, it's reminding me that I could approach walking in a different way or anything. So just kind of changing my lens to look at what's before me in a way that maybe is offered as a help to me instead of some dagger. So that's it.
Thank you. I have to admit, I'm being really selfish by asking you all to share these things. Because sometimes it's hard for me to find my own healing center. And it's nice to be reminded of how many ways there are available to nurture ourselves so that we can come back and offer our gifts. Thank you, how can I help is like my watchword. Katie, you were talking about feeling really blessed. And I wake up every day, and lately that's the words that come to me are, thank you. How can I help?
A practitioner is giving a client a treatment and has a strong intuitive sense that there is some stuck energy related to the client's father in her sacral area. She asks the client if any memories about her father are surfacing as she works on the area. The client relaxed strongly that she does not want to talk about her abusive father ever. The practitioner persists, saying she needs to work through the trauma to let it go.
Well, in our group, we felt that the practitioner was too forceful, that the client needs to do whatever they need to do in their own time. And we felt that it was better to just say, okay, well, how can I help you today? Something like that.
Yeah, that makes a lot of sense to me. It feels like the practitioner's pushing maybe inappropriately. What was your conversation?
Well, we both came to the same point where we sense what's in the body. We don't address the result of that, but rather we look at what's present and treat that. Yes, here I am. Can you hear me now? Yeah. So yeah, we treat what's in the body, not necessarily the reaction, and both of us would approach very cautiously. And in my practice, I always start with, what did you feel in the session? Wait for them to say something, and then I wait for them to ask me if they have the question, what did you see? And then I would introduce it slowly to see if they would want to respond.
So letting the client take the lead on kind of the unpacking any material, right? And allowing it to emerge from the client if it's going to, rather than imposing. It feels like in this scenario, the practitioner sort of imposing their own interpretation and being too forceful. Yes.
So what came out in our session was talking about looking at ethnicity, and power, and really wondering, are you pushing your power onto that person as opposed to being there with that person and allowing the trust to build? If this is something that you feel, you hold on to that. And if you get a chance to work with that person again and build that trust, then you begin to touch such a subject such as this. So that was what we came up with, really looking at culture.
Thank you for saying that, Dolores. I think that it's also true that you only have 40, at the most 50 minutes in a session at the Charlotte Maxwell Clinic. And to open a door to something like this and then send someone out into the world doesn't feel like creating safety. So I agree with you completely. Build the trust and let the person, I keep thinking of a healing as a snake, as it grows, it peels off its skin. And you can't make a snake grow by ripping its skin off. At the right time, it will happen.
Because we have 5 of these, so we're going to keep rolling. But I wanted to just throw in my thought too. Sometimes when we send something in a client, it's really our own stuff. So that even that check initially with like the strong intuitive hit about the client, I always do the double check. Is this them or me? And probably in this scenario, we don't know the whole story, right? But it's not appropriate to call it out at all. Let's do another one, and we have some varying scenarios here, but let's look at number 2. The client arrives late for her appointment at the clinic, flustered and upset. The volunteer shift coordinator does not look up from the computer screen or make eye contact with the client and says she may be too late to receive treatment. The client bursts into tears and begins to loudly complain. She asks to speak to the manager.
We discussed that you should always make the client feel welcome with eye contact and acknowledging them no matter what state or how late they are when they come in. And, you can just work with the shift coordinator and their practitioner and be like, let's see what we can do for you today in the amount of time that you have. And then maybe even if they just have a smaller, shorter session, they can still be in the reception area and have some tea and browse the other offerings we have. And just, this arriving to the space itself is often very healing. And so getting there and just having a moment wasn't wasted, so.
Beautiful. Yeah. And it seems like just pausing to kind of acknowledge that this person is flustered and upset, right? First, and then allowing that arrival. And anything else? That seems like the crux of this one. Was there any other group that had another component to add to that? What was that? The shift coordinator needs some. Yeah, it looks like there was a misstep there, and of course we don't know the context for that person. But yeah, that we should always greet them at the door, right? We need to greet and welcome the client, and like you say, we have so much to offer in the waiting room, right? And then I think a lot of our modalities, we can adjust to a shorter time if needed. I mean, obviously there gets to be a point where lateness can really throw things off, but there's another way with this. Yeah, I think this one, this was pretty simple. The practitioner is preparing to start the session with the client and notices some broken skin on the client's feet. The practitioner, using universal precautions, puts on some gloves and then proceeds with the massage. And this was not discussed by the practitioner or the client, but after the session, the client called the clinic manager to complain of the racist treatment she received, that her interpretation that was that the gloves were donned because of the client's skin color. So let's contemplate for a moment.
I wanted to say that the practitioner should probably have informed the client that she had some broken skin. The client may not have been aware of it, and that's a health issue that the client needs to be aware of because she should continue to take care of herself. And then it probably would have been best if the practitioner had explained that the gloves are to prevent infection. Having said that, if this incident just went on, hopefully it's one of these things that the practitioner will learn from and not make that mistake again.
Right. Thank you, Pam. And that's such a good point. We all make mistakes and we can learn, but just the conversation. So again, it feels like a lack of communication, and how important it is to reflect that, because people don't always know what's going on in their lower extremities. Yeah, and it could be, yeah. I'm curious if on this side, if any group had something to add. Yes.
Those are really good points. We thought that this was this could happen, not an unlikely scenario that somebody would feel kind of weirded out and maybe a little bit targeted, and that there are better options like socks or putting on a sheet than gloves, aside from the lack of communication issue. Anything else?
So yeah, if there one would be sharing about the broken skin and talking about options. I know getting a massage with gloves isn't that great. I know. So thinking about options, and again, this sort of lack of communication that happened. Any other points to be made here? Yeah.
One other point in that the practitioner should have gotten the permission from the client of how to proceed.
Again, that empowerment, voice, and choice. So permission, like, I see there's broken skin. Do you have, one, checking in, are you aware of this? 2, offering a proposal for how they might handle it. I might, it makes sense for me to don gloves to prevent infection. Are you comfortable with that? Or again, there's a chance to work through other options, like working through a sheet, working through clothing, shifting to a different modality of treatment if that's in your wheelhouse.
I have actually developed a foot protocol in any setting where I work, and if I have a space where there's not a hand washing station, I always use gloves. But I say that to every person. I think the asking and permission is super important, but you can never over communicate. But I always bring it up. First of all, any massage I'm doing, I'm also asking people. A lot of people don't even like their feet touched in the first place. But what I do say is and I use very inclusive language. Like I might even say we all have more, potential germs on our feet than the rest of and so I don't want to be spreading, since I can't take time out of our session to leave and go cleanse my hands. If it's okay with you, I think I would add on, I'll be putting gloves on just for the foot massage so that I'm not spreading anything from your feet to the rest of your skin.
Yeah, it's very, very logical. All right, so we have a couple more interesting scenarios, so I'm gonna advance the slide. Practitioner called in sick at the last minute, but the client showed up for her appointment. To avoid disappointing her, another practitioner agreed to fit her in between her regularly scheduled appointments. Since the time was short, the practitioner reviewed the chart and hurried to apply a treatment. The client was very concerned about her immune system and was having trouble sleeping because of anxiety. The practitioner noted the client's condition, but being in a hurry, did not fully register the true state of panic that the client was experiencing because she was quiet and compliant. After the treatment, the client called the clinic to complain of lingering pain and bruising at the needle site, expressed fear that the practitioner had used expired needles and caused an infection.
Reading through this scenario, I think the most important thing is not to be in a hurry. To hurry through the chart, to hurry through the session, and then to not be grounded in oneself and then connected to your client before. And the whole thing just sounded like it was a haphazard, trying to fit in someone. And I mean, it's okay to fit in someone, I believe, but I need to prepare me first and then meet the person and get to know them a little bit before I start. And if I'm going through the chart and I'm hurrying, sounds like the whole thing was a hurry thing. And so there was no connection or safety in the session. And so I believe that it's about grounding yourself and connecting with your client.
Thank you. Anybody else have something they want to say? Carrie? Can you come up here? I can't come that well. As far as I can go. Can't go any farther.
Oh, come closer. Okay. This is actually something that Pam brought up. But she said sometimes the client just needs to be heard, and that's the most healing thing. And with this scenario, I can kind of relate to being the practitioner who, like, you know, wanted to get to the chart and know what's going on. But maybe the more important thing was to use the time to ask the client what they needed and give them a chance to speak.
Thank you. Thank you very much. I'm looking. Oh, you have someone. Oh, good.
I'll come out soon.
Thank you.
I think in these sessions, we talk a lot about the patient and their safety and their empowerment. And we also have to remember, as practitioners, we have to watch out for our own safety as well. And so in this situation, maybe as a practitioner, I don't have capacity to see another patient in between the ones I regularly have scheduled. And it's okay for me to say no.
I wanted to go back to this slide talking about the polyvagal theory, because for me, I've had a lot of learning about, you know, how clients present, and sometimes when it's confusing, like the person was very agitated but presented very calm, and it was some difficult learning in my career to realize that the very calm and compliant person can be the one who's even more triggered or more having a difficult time because they're more in freeze mode, right? So I just wanted to call that out of like that can throw us off sometimes, even though on one hand she's complaining of symptoms that are more in the sympathetic overload state, agitated state. But when the person's affect is very calm, it can actually show they're kind of even in a more shut down state. And so, again, this sort of reading where the client's at and treating appropriately.
You just reminded me. When earlier I said something about someone might say yes with their mouth, but their body says no. I think, especially as an acupuncturist or a body worker, when you're touching someone, you can really feel if their body is shrinking away from you, that's not consent. And so I'm not saying that happened in this case, but I'm just, as a reminder to all of us that it's part of making a safe space and having trauma-informed care is, you know, being transparent, and part of it is being open to what the client is presenting verbally as well as physically. So another aspect of the autonomic nervous system, the person might be saying yes, but when you touch them, they might go.
Okay, oh, here's another one where they didn't look at the chart. Uh-oh. Okay, the practitioner arrived late and didn't look at the chart. She spoke briefly with the client, then asked the client to lie on the table. Without any further introduction or explanation, she opened her textbook and placed it on the client's belly so she could refer to it. This actually happened, people. She then proceeded to put her hands on the client and began silently doing her treatment. Little did she know the client had explicitly asked not to be touched in certain areas of her body, and these instructions were printed in capital letters on her chart. The client told the practitioner to move her hands immediately. The practitioner persisted, explaining she had decades of experience, and this was the best treatment for the issue the client had requested help with. And again, communication, right? So many of these, it's like a failure of communication. So not reading the chart, but also trying to override what the client says. I love that the client said no also. And like really that if a client says no, really knowing, wow, that's amazing, because it's really hard for people to draw that line in these settings. And two, really honoring that. Yeah. Ollie?
Kind of touched on this a little bit already, but just energetically, this feels very similar to the first scenario where you've got a practitioner kind of imposing on the client, like, this is what you need. The idea of like, oh, no, I have decades of experience. This is the best treatment, as though there's like the one true way of healing, which just personally doesn't work for me. But also just like the client in both scenarios is pushing back and saying like, no, for whatever reason, that's not a thing, or I don't want this, I don't like this. And then the practitioner just like really insisting that, like, again, it kind of feels energetically similar to the first one of just, being able to listen to what people are telling you. And again, kind of that, yes, human engagement and communication, but also like that aspect of like collaboration and partnership. Like, it's not my idea of what you need, it's the thing that we're building together. And just that connection just does not really feel like it's here.
So that, thinking of the honeycomb slide, right? The collaboration that we try to bring to the treatment is a collaboration between the practitioner and client. And here that was really breached. There wasn't a respect and a back and forth.
I think the practitioner needs to pause and really sit with their own integrity and where they might be moving from as a practitioner. Yeah.
And what a good reminder, like, especially when a client asserts something like that, really taking that in. Also, there's a chance to apologize or repair that was missed here, right? And I think it's, when we see these mishaps, it's easy to sit here and go, oh my God, how did they do that? But we've all made mistakes, and recognizing, oh, there's an opportunity, there's a missed opportunity to repair and acknowledge, I'm so sorry. I, hadn't read the chart. I wasn't aware of that. And, then moving on. But here it was just kind of steamrolling. Yes.
I see a violation. I guess I'm going too deep.
We're trying to empower our clients to be better consumers of healthcare. And here we have two clients who actually said, no, stop, that doesn't work for me. They spoke up for themselves, and I feel like we're doing something right, even though these are, hard situations to talk about. I want to talk about them because I want us to learn from them as a group, as a team.